think that because we had defunded DHEC, we were in not a great position to do the things and the public health measures that you want to be able to do very immediately if you have a public health crisis. Like I had mentioned a moment ago, being ready for any type of public health crisis is very important to a state. And we know that the negative effects of a pandemic threat are not just limited to the immediate dangers that happen with public health that everybody feels very quickly, but also to the threats to our economic viability, which I think people began to appreciate on a much slower level. And we need to have leaders in place that have expertise as well as character, who are willing to be, like I said, present in crunch time and during a crisis, who will work together with public health leaders and with plans that build on the very basic elements of controlling the spread of a public health type of infection. This is maybe a novel virus, but it's not a novel experience. There have been other types of pandemics and epidemics. And we want to make sure that our economy, churches, schools, everybody can function safely, and we need to optimize our ability to do that. And so the things that should have probably been in place and should have been capitalized on, and which things that we should move forward with now is to make sure that we have testing available for people, because that is a mainstay of maintaining any type of public health threat, is testing for everyone, accessible, free, widespread type of testing for the virus, so that carriers can be identified, especially people without symptoms, because we know that they could be walking around and getting other people infected. We need to have increased and ongoing support for South Carolina DHEC, for public health workers, and the use of really innovative digital technology that it can be adapted for mobile apps, because everybody has a phone. This helps us to perform contact tracing to reduce ongoing exposure. And there are other places that are doing this, and it's something that we should be able to do as well, to have the resources put towards methods like that. And then also talking about the safeguards that we would need in place. That includes financial and academic safeguards for people who have to be out of work for school or quarantine, because we know that that's really actually an important part of this, is making sure that people are able to quarantine after the contact tracing. But that obviously has to be done on a voluntary basis, and has to be, but to make it feasible for people, we have to have safeguards in place for them. And what that means basically is, again, these areas are interconnected. We have broadband access from home, so that if they're quarantined but well, they can continue to do their jobs as much as possible. They continue to do their schooling as much as possible. And so that broadband access that wasn't in place needs to be in place, and can no longer be treated as any type of a luxury. It is similar to electricity and water now these days, for people to be able to access those things as far as healthcare. Because for a while there, people were only able to see their doctor like that, or through education, or obviously to be able to do their jobs. And then, the basic things, right? This is going to sound very basic, but the wearing a mask. We know that the jurisdictions that have had a mask mandate have had the great outcomes of having fewer cases and having a reduction in their positivity rate. And then again, that's just data, right? So you can throw data all you want at people, but people are looking at those kind of numbers. And we know that places that have had a mask mandate have had a decrease in their positivity rate. And DHEC has put out an article about that just recently, here in South Carolina. And other places are doing this successfully. And it's one of those things that comes down from the top, and people do follow and watch what their leaders do and emulate what their leaders are doing. And we recognize that this is a transient thing, right? Especially because we know that people are working very hard on measures to curb this virus, for things like vaccines and medicines and treatments if people have to get hospitalized. And we're working on these things for quarantine. So we know it's transient. So in the meantime, for people to be able to take care of themselves and take care of others, for our leaders to do that, I think would be a sign of goodwill towards our population, as well as what leadership should do at this point in time.